Hello, everyone. This is Sherry from the CGH Health Foundation. Welcome to our program today. Today's one of our Growing Healthier educational series. These are the programs about important health topics sponsored by the CGH Health Foundation. All of our Growing Healthier programs are presented here on Facebook Live, but you can also find them on the CGH website. Just go to the website and click on menu and look for YouTube and radio interviews. November is Alzheimer's Awareness Month, and that is the focus of our annual campaign at the Health Foundation this year. We have had a series of workshops on the financial and medical and legal and emotional aspects of caring for someone who has Alzheimer's. And we've also worked at establishing support groups in a lot of area communities so that those caregivers have a local place to go and share information and ideas and get a little bit of a respite there. So since November is Alzheimer's Awareness Month, we invited Dr. Preeti Joseph from the CGH Neurology Department to come and have a conversation with Dr. Bird today about the various types of dementia, including Alzheimer's, and the testing and treatments that are available. So Dr. Bird will be talking to Dr. Joseph in just a moment. But before I turn it over to him, I wanted to mention our next program, which will be on Thursday, December 1st. And if you remember from June, we had Dr. Song talk about men's and women's sexual health. And she must have had a lot more that she wanted to say. So she's going to come back on December 1st and do another program for us. And with that, I'll let Dr. Bird take over.
Thanks, Sherry. Appreciate it. Welcome, everybody. Glad you could be here for Facebook Live. Today, we have Dr. Preeti Joseph with us. Hi, Dr. Joseph.
Hi.
So, hey, fun fact, this is the first interview that we've done with someone who is in a vehicle. So, hey, congratulations on that.
Thanks.
We were talking, and I think you're in Norway right now, right?
Yes. Can you see the beautiful scenery around me in the car?
All right. So we were laughing about where we would have her roving at, but we're glad that you could join us, and glad you could answer some questions about dementia. So as always, oh, by the way, before I get into the interview with Dr. Joseph, the roadmap for this today on Facebook Live, I'm going to talk to Dr. Joseph, and we're going to ask her some questions about dementia. Then we're going to go into some updates about respiratory illnesses, and then finally we'll do some shout outs. So that's our roadmap. So Dr. Joseph, let us kick off with some dementia questions here. Okay.
Sure.
What's the latest research? And as always, those of you who are watching live, send us any questions you might have. We'll be glad to try to answer those for you. What's the latest research showing about the causes of dementia?
Well, that's an interesting question because dementia is a big umbrella term. We have lots of different varieties of dementia. So it really depends on the type of dementia that you have as to what's going to cause it. The most common variety is Alzheimer's. It's about 40 to 60% of dementia. Dementia is kind of an umbrella term. So okay. Alzheimer's, we have suspicions, sometimes there's controversy exactly what is causing it, but we have suspicions that there are protein clumps and tangles, these proteins that build up in the brain that is considered the cause. Amyloid is what you'll hear about or read about sometimes on the internet. And those are forms of protein that clump and kind of clog up the communication roads between the brain cells. There's vascular dementia that's caused a lot by strokes and blood pressure and different damage to the brain with blood vessels. There's Lewy body dementia, which has a different clump of protein called a Lewy body that can cause it. There's frontotemporal dementia, where you have shrinking of the front and the temporal, which is the side of the brain, that causes that variety of dementia. So it really is dependent on what variety of dementia you might have.
Yeah. I've heard like that. We've gone at these amyloid tangles, and that we think that's it, but it also could be the product of those tangles, could be a product of something else that actually is the inciting cause, and it gets pretty interesting when you start going down all those angles.
Mhm. And especially with the newest drug that's come on the market called Aduhelm, it's an IV medicine, there's been an enormous amount of controversy because we don't know if reducing those amyloid plaques actually does lead to improvement of memory. And so that's why people are starting to question, is
Yeah.
that really the cause of Alzheimer's variety or is it not? So honestly, we really don't 100% know. We know that brains with Alzheimer's and dementia of Alzheimer's type tend to have more of these proteins and plaques, but is that really the cause? I think we're still not convinced 100%.
Yeah. I'm gonna go off script a little bit. Did I read recently where how many neurons do we have in our brain? It's crazy.
Oh, yeah, it's a lot, and we don't use many of them. So I don't want to quote you an abnormal a number, because then somebody's going to Google it and say that's not it.
I know. For some reason, what pops to my mind is like 100 billion or something crazy like that, and they all have all these connections, and
Mhm.
yeah, it's
And
just
so,
fascinating.
and we don't use most of them, and so we have a lot of, especially in Alzheimer's, we have a lot of give to when people start really having symptoms, because we start losing so many um, nerve cell functions before we finally reach a point where you're going to show up to a doctor's office or to a family member's attention that things are not going well. So, I think the goal of dementia management and research and stabilizing dementia is trying to figure out how can we protect that brain way before somebody starts having symptoms.
Yeah, let's talk about then. So let's talk about that just in the sense of how do you go about making a diagnosis of dementia?
So
Like a
in
short-
this day and age, things have actually changed in the last 5 or 6 years. First and foremost is the clinical exam, clinical situation, clinical history. So when somebody comes, I really ask some of the questions as to what were you doing? What are you doing now? What's changed? The second is we start doing some basic blood work and making sure that you're not low on certain vitamins or certain blood issues. If you're, severely anemic and you don't have enough blood, you're not going to think right. Or, if your electrolytes are off, or your kidney or your liver. So those are the basics of the first appointment. And then we usually get you set up for a brain scan. We like the MRI. I like the MRI better. It's much more detailed, but some sort of brain scan. I want to make sure, do you have a tumor? Do you have something else that's causing you to not think properly? And then we've gotten a little bit more fancy in the last 4 or 5 years, where if you're somebody, especially who's younger than 65 and starting to have memory issues, we have spinal fluid tests that we can actually send off for Alzheimer's. We actually have a test that we can use that is a specific brain scan called an FDG PET, looking for these amyloids. And then there is a test called Procivity AD that is a blood-based test that got approved, but is not covered by any insurance. So we've come a long way in Alzheimer's diagnosis. But in general, with dementia, we want to do blood tests, we want to do a brain scan, we want to get a good history.
Can you talk a little bit more about that blood test that gets sent out? Insurance doesn't pay for. What information that will it tell you as a doctor?
So they're specifically looking for amyloid, and they're specifically looking for tau proteins, and they're looking for this ratio to see how much is in your blood compared to what they consider someone with Alzheimer's or someone who does not have Alzheimer's. And so I think it's about $1,300, $1,250. I don't know if they've raised the price recently, but it is not covered by insurance of any sort, Medicare, Medicaid, or any private commercial insurances. So it's all out of pocket at this point, but that's one way. The spinal fluid test, though, I haven't had any issues getting that covered, but it is definitely much more invasive. You have to have a spinal tap for that.
Sure. What role I know you have a machine or some sort of testing machine in your office where you're asking patients questions. How does that play into that whole diagnosis as well?
That's more of a cognitive screening test. So it's called NeuroTrax. It's simply a more detailed test to evaluate your memory in a structured format. So it is FDA approved, or it's actually approved for being able to test memory. So it tries to replace the neurocognitive test. And unfortunately, we don't have the ability to do a full neurocognitive test with a neuropsychologist in the Sterling area. And so most of the time patients have to go to Moline or Rockford or Peoria. So we're trying to get this so that it's a computer-based, you sit down and take this.
Okay. And why people under 65 versus over 65 and doing some more of that in-depth testing?
So it's more common for patients over 65 to start having memory issues and dementia issues. As you can imagine, especially the vascular dementia, as we get older, our blood vessels are not as clean as they used to be. We have more stroke issues or blood pressure issues, that kind of stuff. But if you're younger and all of a sudden start having memory issues, it's twofold. Number one is I want to get a clear diagnosis. Is it Alzheimer's or is it not? And secondly, at this point, if it's Alzheimer's, I want to be super aggressive on how am I going to get you treated and stabilized, whether it be joining a clinical research trial or whether it's trying one of our newest medications. I just want to be very aggressive. Sometimes if you're in your 80s and 90s, it's hard to join a clinical trial because of transportation or other issues. You might have many other health problems.
Sure, that makes sense. So Dr. Joseph, you already did talk about the different types of dementia. What I was curious if you could go into as well is if there are any differences in the clinical presentation of what those look like for patients. And
Sure. So with Alzheimer's, which is the most common variety, it's we say insidious. So it's very slow and people start having short-term memory issues predominantly. And it's gradual and then it interferes with functioning on a day-to-day basis. Versus there is other variety called Lewy body dementia, for example, that causes a lot of hallucinations and difficulty, not just with short-term memory, but paranoia and behavior.
Okay.
Another variety called frontotemporal dementia not only causes the memory issues, but also significant behavior problems. So if you have a slow, gradual difficulty with memory, but you're not having any hallucinations or paranoia or behavior issues, it's most commonly Alzheimer's. But if you start having some of these unusual symptoms, you're seeing and hearing things that are not there, you're having problems where your personality changes, or others notice that all of a sudden in the last few years, your personality has really done a change from where you were. Those are reasons that we start thinking of the other varieties.
Okay. That makes sense. Thank you. So let's talk a little bit now about any, I know this has been a topic that hasn't been as fun because hasn't been as many of them, but talk a little bit about any treatments that are out there now for people who have these various dementia diagnoses, if you would.
Sure. So unfortunately, we haven't had a lot on the market for many years. There are two different categories of medications that are being used in this day and age. One is called a cholinesterase inhibitor. And so the most common drug you'll hear about is donepezil or Aricept. It's typically for mild to moderate and also severe dementia. But it's the most commonly prescribed. It's the first line drug typically that we will use. From a different angle to support the memory is a drug called memantine or Namenda. And again, it's trying to support the memory. And we use it more for moderate to later stage dementia. But honestly, I think as neurologists, we put both of those drugs on board. I always tell people it's kind of like lifting a box. You can either do it with one hand or two hands. And one hand is one drug and the other hand is the other drug. So let's support that memory as much as possible. Neither of those medications change the course of whatever it is that you've got. They simply try to hit the brakes on it as much as possible. But they're not great. We do have a new IV medicine called Aduhelm, and it's IV. And the medication has caused a lot of controversy because of the fact that it was felt like it was rushed through because we didn't have a lot of options out there. And so people were just trying to cling on to any hope possible. So the medication currently requires confirmation of amyloid. So you either have to have the blood test or the spinal fluid test to confirm you have Alzheimer's. You've got to have mild symptoms, or you've got to have mild cognitive symptoms with the amyloid, and then only can you get into this study. Actually, it's being done more as a study now. I don't know if so many insurances are covering it, but if you got into it early, you could still be on the drug. I have one patient taking the medication. But there's kind of exciting news. There is a drug that I think is going to probably get FDA approved in January. Lecanemab, I don't know if I'm pronouncing it correctly.
Yeah, right.
It is going to be injectable twice a week. And so it's actually shown quite a bit of promise. I think it had like 25 to 30% improvement in functioning and preserving brain from, worsening amyloid. I mean, everything's been targeting amyloid,
Right.
but they've actually felt like it actually corresponds to improved memory. So that's kind of exciting because that probably they're estimating is going to get through the FDA and get approved around January of 2023. So
Okay.
not too far out.
Yeah, very good. Okay. Next question I have is there any testing that can be done to see not if you have dementia, but if you're at risk for getting it?
So for Alzheimer's dementia, there is a genetic testing for 3 different varieties of genetic foci or locations. There is a variety of Alzheimer's that's very strongly hereditary. So for those 3 different genes, there is testing available. But the vast majority of Alzheimer's is not just one gene. There's lots of factors that they think play a role. And even those 3 genes, they have found that if you have it, it doesn't 100% predict that you're going to get the condition. So on a broad scale, can you send it in for one of these DNA tests and know you're going to have it? No. But, I think that's definitely something that's out there for the future. And everybody's hoping for, especially the ones that have a lot of family members that might have it.
Right. So the genetic tests aren't 100%, and there are other factors that come into play. And so that's what I want to ask you about now is, what are the other things that we can do to lower our risk of getting dementia? Any thoughts on that?
So there's about 8 different things that are known to increase your risk. So blood pressure, diabetes, lack of exercise, lack of cognitive stimulation, smoking. So what can we do? We can make sure that you're getting regular health checkups, maintaining your blood pressure, making sure your blood sugars and your electrolytes and everything are monitored. As we all get older, we have to make sure and be careful about the medications we take. There are certain medications that can increase our risk for memory issues overall. So, common things, certain antihistamines like Benadryl can worsen memory. Certain medicines that are used for headaches and for depression like amitriptyline can worsen memory. Certain bladder medications like oxybutynin can worsen memory. So trying to keep polypharmacy down, trying to increase exercise and activity, trying to maintain blood pressure, maintain blood sugars, and then stay mentally active. I feel like a lot of us, as we go into retirement, decide, well, I don't have to do anything. And so I choose not to do anything. And that's one of the worst parts for our brain. I think the goal is trying to do and learn something every week or every other day, or, trying to get our brains to stretch beyond the routine. I've been saying this analogy recently to my patients. I say, when you live in a home, there are certain rooms that you use and there are certain rooms you don't use unless company comes over. And so what happens is we get lazy and those rooms get dusty and they don't really get cleaned out all the time because those are not the spaces that you live in. And our brains are the same way. We start using a little bit of our brain and the rest of it kind of gets dusty and shut out unless we're stretched beyond our comfort zone. And so what the goal is as we all get older is to keep all of these rooms in our brain and our house, active and clean and, stimulated. And so the goal is that will help improve and maintain our memory as we age.
Yeah, that makes a lot of sense. This is kind of a plug for people going back to like Sauk Valley Community College. Right? Something just to make your mind think about something and do something. And I'm guessing the answer to this next question is similar to the last question, but I'm going to ask it anyway. So you get dementia, you get a diagnosis of dementia. What are the things that we know if there's anything that helps to slow the decline of that dementia?
So it's kind of the same kind of thing, trying to eat healthy, trying to exercise, trying to maintain a balanced nutrition, that kind of thing. So one of the things that has been shown as far as diet is a Mediterranean diet. And what's a Mediterranean diet? It's just trying to eat less processed food, trying to eat more fruits and vegetables, using olive oil instead of, animal fat oils, trying to put more legumes and beans and those kinds of things into our diets. So trying to do things so that our brains get the nourishment that they need, that it needs. We don't have two brains. And trying to keep our bodies and our brains as active as possible.
Good. I want to transition now just to talk about like support stuff that you're able to give or others are able to give to patients and their families. So if you could just talk about how you help patients and their families navigate finances, driving, living at home, all those kind of things as a patient's disease progresses.
A lot of that is conversations from appointment to appointment in our offices. Unfortunately, as a physician, I end up being the bad one who has to tell somebody they can't drive, because it's hard for your loved one to sometimes tell you that. A lot of times, those are conversations that we have every time, who's managing the finances? How are you doing things safely? There are many people that get scammed. Just the other day, I had somebody who was called up and said, their loved one was in a detention center and they needed to send $5,000 worth of gift cards to a certain address, and they actually did that. And so we have to be very aware that those kinds of things happen, and in educating. The Alzheimer's Association has a local chapter based out of Rockford, but is very engaged in the community that will help provide some of those resources, even to help with respite care and what's out there as far as, maybe a day center so that, you can help engage your loved one in various activities. And then the exciting news is the CGH Foundation has really had a great initiative this year to fund a navigator position to try and help families navigate all of those areas with finances and driving and all of that. So, CGH as a whole is doing exciting things when it comes to all of this.
Yeah, for sure. And that's actually my last question and you kind of answered part of it, but can you talk a little bit about what you're doing along with our CGH Health Foundation in regards to dementia education and awareness, like some of the work that you're doing and how you're working with the foundation, Dr. Joseph?
So I've been involved in different presentations. I know I gave one presentation several months ago as an educational opportunity, but they've had a series of educational opportunities with various speakers based on different aspects of the whole disease process of dementia. And so personally, I'm available to help, especially in taking care of patients in the office and the clinic. But beyond that, working together with the community, with our soon to come navigator, to try and just help all of us get where we need to go when it comes to this disease. We're charting uncharted territory, so to speak, because we all are finding out new things as the months and years go along, and we want to make sure we take care of our patients, because our patients are our community, our loved ones, our coworkers. It's amazing how many lives are affected by dementia.
Yeah, unfortunately, yeah. Yeah. So, hey, Dr. Joseph, thank you for taking the time to stop driving and and do an interview with me, and appreciate all the work you're doing here in the community to take care of these patients.
Oh, sure.
So,
Happy to help anytime. I love modern technology. It's nice to be able to come into a virtual event like this.
Safe travels.
Thank you very much. Happy Thanksgiving to everyone.
All right. Bye. Okay, great. Very nice to have Dr. Joseph with us. Okay, so I'm going to transition to the next part of our broadcast here to talk about RSV, influenza, and COVID, the trifecta, if you will. So RSV is still a big hitter in the community. For most adults, it causes a significant cold and cough type of symptoms. Sometimes for younger children, because their airways tend to be smaller, it can make them even more short of breath, and occasionally they have to come to the hospital and get treatment and or be hospitalized for RSV. So that's definitely probably the biggest respiratory illness working its way through the community right now. What's unusual about it this go around, because it happens every year, is it's happened a little bit yeah, it's definitely happening earlier than I've typically seen it. Typically, it's more like that January through April surge time. The surge has been bigger, and the speculation is that kids for the last couple of years haven't really had a lot of respiratory illnesses, and so now when that's hitting, it's just their immune system's not quite as good, and it's also maybe it's had a little bit of a variation on the virus itself, which is making people a little bit sicker. So that's RSV. Influenza, we're starting to see a few cases, although I wouldn't say we have a significant outbreak in the community, but there's definitely been some influenza, which symptom-wise is once again pretty similar to the other two. It typically is cough, congestion, fevers, chills, those type of body aches, those type of things. And COVID continues to be around and continues to be an issue, and the variants continue to vary. So that also is a player. We continue to have patients in the hospital that have COVID. So that's kind of what's going on in the community as far as those things go. Just a few facts that I was just taking a look at before I got on today. Right now, about 200,000 U.S. citizens have died from COVID during this year, 2022. Just to give you some perspective on that, in a really bad flu season, you're usually talking about 50,000 deaths. So 4 times that in terms of COVID thus far this year. And obviously we have 2 more months to go. During the August peak that we had this past August, what is it, 91.9, let's say 92% of the deaths were people over the age of 65. And for those who did pass away during that peak, you were 6 times more likely to die if you were unvaccinated. So it's really important, to get vaccinated. And speaking of which, right now, a little over 25% of the people over the age of 65 have been vaccinated with the bivalent vaccine. So I definitely think there's an opportunity there for more folks to get vaccinated, and I would really encourage that. I got my bivalent today, so it's definitely something you need to do. I waited because I had COVID, and you're supposed to wait if you've had COVID. Go ahead and get the vaccine. You can get the bivalent vaccine if it's been 2 months since your last vaccination, but 90 days if if you've had a recent infection. So what would I recommend? Get up to date on your vaccinations. And if you are sick and you're going to be, even if you don't have COVID and you're not in isolation for COVID, if you have RSV even, go out. When you do go out, throw a mask on. And if you are immunocompromised in any way, if you're in a setting with a bunch of people moving around, I'd still wear a mask. So those are some recommendations that I would have for you. All right, that's the respiratory illness update of this broadcast. And finally, I wanted to do some shout outs. So we have quite a few. So this is American Association of Nurse Practitioner Week. So Nurse Practitioner Week, want a shout out to all our nurse practitioners here at CGH. They do really good work, and we're really glad to have them. Next week is Perioperative Nurses Week. So those nurses that are working in and around our operating room. So happy Perioperative Nurses Week. Let me pull this up. My screen goes out on me once in a while. Okay, National Rural Health Day. So yeah, we are rural, and so this is a day for us to celebrate here at CGH. We provide health care here in our rural community. So good. What else do we have? Oh, yeah. So if you want to get accessorized, we have a jewelry sale going on here at CGH in our auditorium called the Ryberg Auditorium. So if you go into the main entrance, you could take a left, another left, and you'll be there. So a lot of merchandise leaving. And also, speaking of merchandise, our CGH Auxiliary Gift Shop has a lot of nice gifts that you could buy. And what's next? Blood drive. Yeah, we have a blood drive December 1st at the Ryberg. And I'm told that, of course, we want everyone who's willing to give blood to come, but O negative and B negative donors are in critical demand. So if you happen to be one of those blood types, please reach out. We would really appreciate you donating. And finally, I think this is the final slide that we have. On December 1st, Dr. Song and myself are going to continue the interview that we had. I think it was September is what Sherry was saying. We're going to continue our conversation about men's and women's sexual health. So looking forward to that conversation. Dr. Song is always very engaging and does a really good job. And yes, wishing all of you a happy Thanksgiving. And until December 1st, hope you have a good Thanksgiving season, and we will be seeing you in a couple of weeks. Thanks for watching.